Here we have what's known as our manual processor. And as you can see, it has each of these little individual cups located inside. When you're ready to process, what you would do is you'd stick your cup with your gloves. You would fill up each of these cups with your developer, your water, your fixer, and then this one at the end would also be water. So the way this works, this is also known as manual dipping or hand dipping. And what you would do is basically set your film one at a time, first in the developer for a period of time. You would then transfer it to the water, rinse that off, place it into the fixer for a period of time, and then last would be to remove all of that solution off with that final rinsing of that last cup of water. As you can see here, it is temperature controlled, so you would actually have a thermometer that you would be checking your temperature to make sure that it's within these appropriate ranges here, and we tend to use Fahrenheit. So based on that temperature, that's letting you know how many seconds each of the film need to be in the developer and in the fixer for. So that's going to determine, again, based on the temperature, how long you're keeping it in each of the cups before you are rinsing them off with the water. Here you have our chemicals that we would fill those cups with. We have our Instafix, which would be our fixer, and our Insta-Neg, which would be our developer. So if any of you have ever taken a photography class, I'm not sure if they still do that anymore. For those of you who might be a little bit older, probably remember having to, with your film, you had to process it. And if you took a photography class, this is kind of the same way that they taught you to do it, is you did each of your films manually. Basically putting it in the developer, then the water, fixer, and then you would hang it up to dry. So it's kind of the same concept with our X-ray processing when we're doing manual or hand dipping. And the way this works is you would place, like I mentioned, your cup and your gloves in there, get those ready to go. You would close your window here. Since we are not using a dedicated dark room, this is acting as our dark room. So we can see that this red covering that's on our the outer part right here would be considered our safe light. So it helps to prevent any kind of light contamination that can occur on our film as a result of being exposed to just the light that we have within our rooms. So once you're ready to go, you would ungloved hands, clean hands, you would stick them into these little areas right here, these sleeves, and as you can see, you would be able to see what you were doing. So the way that works is you would place, once you're in there with your gloved hands, you would take your film, you would open them up, you would place them onto these hangers with this door closed, remember, because we don't want any to expose our film to light. We would then place it, our hangers have like a little hook. We would place it into the container, the appropriate container, kind of hang it off the side, and then we would close our door and we'd keep it in there for the appropriate time, again, depending on what our temperature was when we checked it prior to. Once it was there for the appropriate amount of seconds, then you would take that out. Like I mentioned, you would then make sure that you rinse that off properly. Then you would then put it into the fixing solution, hang it off to the side here, close your door, and same thing. So finally, once you were done, again, keeping it for the appropriate time, then what you would have once you were done is your X-ray or your film, and if done correctly, you should be able to diagnose off of your film. A lot of different things can occur as far as errors if you don't keep it in the developer for a period of time, if you don't keep it in the fixer for a period of time, then your film is not going to turn out very good. So you have to make sure that if you're ever using this type of a system, that you're paying attention to your temperature and also for your time. So this is something where you probably need to have some sort of a timer for. I hope you will never ever have to do anything like this. This is something that we talked about, 21 years ago when I was in school, but thankfully it's not anything that I've ever had to do. I've had a friend that worked in a satellite office in a very small town, and they did not have a designated dark room, nor did they have an automatic processor. So this was how they had to process all of their films when they went to that office twice a week. So it's kind of a pain because you're doing this individually, one film at a time. So if you're doing a full mouth series of x-rays, then it's going to take quite a bit of time to do that. And then if your x-ray didn't come out right, then you also have to go ahead and redo it again. But this is kind of what that system looks like.